written demonstration for today is all about administering of oxygen by nasal cannula. So before we start with our procedure, let's first talk about oxygen therapy. So oxygen therapy is being commenced or being increased to avoid hypoxia, and it is being reduced or ceased when or to avoid hyperoxemia. While nasal cannula is used when there's a low flow or low or medium concentration is necessary and the patient is in a stable state. So, oxygen administration or administering of oxygen is in variable manner, which means that the amount of oxygen that is administered or delivered will be based upon the patient's breathing pattern and breathing rate. And therefore, it should not be given to patients in acute phase of disease, especially when they need a regulated oxygen therapy. Equipment needed for administering oxygen by a nasal cannula includes nasal cannula, the goose pad, assuming that it's goose pad. We also have here stethoscope, the PPEs, including the gloves and the mask. And we have here alcohol for hand hygiene, or we can also use soap and water. So we also need to have the oxygen tank and the oxygen regulator. So for the oxygen regulator, we have here the parts. So here is the pressure gauge. This is the pressure reducing valve. Screw cup. Under the pressure reducing valve is the safety valve. This is the flow meter. Under this will be the flow adjuster. And this is the humidifying cup where we fill it with water. We fill it with water for humidification to avoid drying of the mucous membranes. And also we have here the oxygen outflow where we connect the tube or the oxygen tube. Emphasizing we need to have no smoking sign here to bring awareness to those people, also the significant others, that they should not smoke since oxygen is flammable. So for our first procedure, bring necessary equipment to the bedside stand or over bed table. So for the second procedure is to perform hand hygiene and put on PPE if indicated. So after we put on our PPE and perform hand hygiene, the next step is to identify the patient. In identifying the patient, we need two identifiers. First is to the name of the patient, and second is to check for the identification band or bracelet. So in here, we also check the doctor's order. Okay. Good morning, ma'am. I am Melva Inacario, your student nurse for today. May I know your name, ma'am?
Anla Godin.
Okay, may I check your identification band, ma'am? Okay. So, thank you, ma'am. Next step is to close curtain around the bed. And close the door to the room if possible. So we close the door and the curtain to provide privacy to the patient. Next is to explain what you are going to do and the reason for doing it to the patient. So ma'am, ang gagawin po natin ngayon ay ang tinatawag na administering oxygen via nasal cannula. So dito po gagamit tayo ng nasal cannula po. Yung nasal cannula po, ilalagay po natin. May tube po yun, may tube po siya na clear na ilalagay natin sa ilong natin. Konektado po siya sa oxygen tank. So yung oxygen tank po natin is meron siyang regulator kung saan meron po cup na merong lalagyan po natin ng tubig. para ito po yung makakatulong para hindi mag-dry yung sa ilong nyo. Tapos, yung tube po na nakakonect doon is meron pong magdadaloy ng oxygen doon na kung saan yun yung i-inhale nyo. Itong procedure po na to na gagawin natin is makakatulong po siya lalo na kung mababa ang oxygen po natin sa katawan. So, ito po yung nakakatulong sa pag-maintain ng tamang level ng oxygen sa ating katawan. Kung matakot, hindi ka po masasaktan sa procedure na to. So, review safety precautions necessary when oxygen is in use. So, place no smoking sign in appropriate areas. So, the next procedure is to connect nasal cannula to oxygen setup with humidification if one is in use. So, adjust flow rate as ordered. So, check that that oxygen is flowing out of prongs. So, this is the prongs. So, you need to check if the oxygen is flowing. And we can also observe the water here in the humidifying cup that it's forming bubbles. Next is to place prongs in patient's nostrils. Just relax me. So place prongs in patient's nostril. Place tubing over and behind each ear with adjuster comfortably under chin. So under the chin, and alternately place the tubing may be placed around the patient's head with the adjuster at the back or at the base of the head. So place goose pad at ear beneath the tubing as necessary. Excuse me, ma'am. Okay. So, adjust the fit of the cannula as necessary. Tubing should be snug but not tight against the skin. So adjust the fit of the cannula as necessary. Tubing should be snug but not too tight against skin. So next is to encourage the patient to breathe through the nose with mouth closed. So, ma'am, huminga ka po, gamitin mo yung ilong mo, ma'am. Inhale. Close po yung mouth, ma'am. Exhale. Okay, ma'am. Very good. So, we need to assess the patient's respiratory status, including respiratory rate, effort, and lung sounds. So, ma'am, excuse lang po. Okay, ma'am. We need to assess for the lung sounds to determine if there are abnormal lung sounds such as crackles, wheezes, and after this, okay ma'am. Okay, after auscultation, we need to check the respiratory effort of our client. Respiratory effort if the client is normally breathing. Okay, so we need to check the time for 1 minute for the respiration. And the next one is to check if the client is using the accessory muscles. It just means that the client is having difficulty of breathing. Note any signs of respiratory distress such as tachypnea, nasal flaring, use of accessory muscles, or dyspnea. So after that, we need to remove our PPE if used and perform hand hygiene. So, in removing of gloves, so insert 2 fingers and then roll. And then we need to discard this. So use the strings, discard. And also we need to discard this and perform hand hygiene. So after performing hand hygiene, put on clean gloves. So remove and clean the cannula and assess nares for at least every 8 hours or according to agency recommendation. So, tanggalin ko na po, ma'am. Excuse me po. So, we need to check nares for evidence of irritation or bleeding. So, let me check your nose, ma'am. Okay. Clear naman po. Wala pong masakit, ma'am. Okay. After this, you need to document your observation, and also you need to remove your gloves and proceed to recording all the necessary information or observation that you gathered. And also you need to document the procedure. That's all. Thank you for watching.